Welcome to Freeman Maternity Center. We're excited to show you around and give you a little insight on what it might be like if you are a patient. Freeman was named one of the best maternity hospitals in 2021 by Newsweek and the Leapfrog Group, so you can rest assured you will receive safe and excellent care from our clinical staff.
This is a 10-bed private labor and delivery suite, so all of our rooms are private with their own bathroom. When you get into the birthing center suite, you can determine if you would like to be someone who just wants to stay in bed the majority of your time. If you want to get up and walk around in the room, we have such things as telemetry monitoring, which means you won't be connected to the monitor the whole time. So you have the free roam to move around in the room, out in the hallways, and we can continually watch your baby on the fetal monitor so that we know that everything is going okay. The awesome thing about those monitors also go underwater. So if you are somebody who likes to labor in the shower, or maybe you've envisioned laboring in the jacuzzi tub for some pain relief, those monitors are able to go underwater. So in our bathrooms, we have a jacuzzi tub with jets. We can lay you in those for a little while and let you labor in that or in the shower. So that makes that very nice. The other wonderful thing we have here at Freeman is we have something called central monitoring. So what is great about that is anytime that you're in this room, in this bed, on the monitor, walking around, and your nurse is not in this room, we as your nurse can see your baby's heartbeat from any other patient room down here, from our nurse's station, from our break room, anywhere else in the whole entire unit. We're watching your baby the whole entire time, which makes it nice for you and your support person because you don't feel like you have somebody in this room with you just the whole entire time you're here. But we are coming in and out very, very frequently, checking on you, but we're always watching that baby. So that makes that another nice factor that we have here. Another wonderful thing we have here at Freeman Birthing Center is we have in-house anesthesia. That means that we have anesthesia in our hospital 24 hours a day, 7 days a week. We're never without it. But the thing that even trumps that for the birthing center is we have our own group of CRNAs that are dedicated only to the OB unit, which means that if you are in this room and you start hurting and you would like an epidural and you're uncomfortable, years ago, way back in the day, it took us a long time to get our anesthesia down here, but now we have our own group that's dedicated right here in our suites, and we can give them a phone call, let them know that you're wanting something, and very shortly they're able to come in here and get you the pain relief that you're wanting. So while you're here in our birthing suites, this will be the room that you will labor in for your whole entire labor. So if you come in at 1 centimeter, you come in at 6 centimeters, it doesn't matter, but this will be the room that you will stay in until you give birth. And yes, you give birth in this room right here. Up above us, when we get closer to delivery, there's 2 big spotlights that are going to come on right at delivery time. And this bed has a special function on it that either we will lower the bed down, the lower part of the bed will come down lower, or we'll take the bed and we'll break it in half, which means the whole bottom part of the bed is removed so that your physician or your midwife can get up there and deliver your baby a little more easy. Maybe your baby is breech, or your doctor has told you your baby is going to be too big and you're worried about how does a C-section look. Well, the nice thing is our unit is unlike a lot of hospitals because our unit has 2 private operating room suites right here on this floor, right down the hallway behind our nurse's station, which means that when you come into the birthing room and you end up needing a C-section for any reason at all, whether it be a scheduled one, whether it be that your baby starts looking, yucky on the monitor, whatever it be, our C-section room is just feet away from the room that you're already in. The greatest thing of all is that the nurse that is taking care of you down here will be the nurse that will continue to take care of you in the C-section suite, and we will also be your same nurse through recovery. Once your delivery is complete, whether it be a C-section or a vaginal delivery, you will be back here with us for 2 hours. We'll have the golden hour. We can help you feed your baby, whether it be the formula or breastfeeding, skin to skin, answer questions that you may have about this new bundle of joy that you're holding. And then after that 2-hour time frame is up, we'll be moving you out to one of our private postpartum rooms where you will be staying until you are dismissed to home.
After your recovery in the birthing center, you and your baby will come out to your postpartum room. Our postpartum department is a 25-room department, and we have all private rooms, all private bathrooms. Your spouse or significant other is able to stay with you during your stay overnight. We have fold-out beds or couches where they can sleep. If you have a vaginal delivery, you can expect to stay 1 to 2 days. If you have a C-section, you can expect to stay about 3 to 4 days. We do offer a congratulations celebratory meal during your stay for you and your significant other. The nutrition department will bring you a special meal with dessert and sparkling juice. We are a locked unit. Anyone coming to our department is screened before they're allowed into our unit, and your baby will wear a security bracelet that ensures that your baby does not leave our department during its entire stay.
We encourage babies to room in as much as possible, but we do have a nursery that's available 24 hours a day where you can send your baby if you would like to get some rest. There are nurses in the nursery at all times. They are caring for babies and they're watching those babies that need to be monitored more closely because of health concerns. You're able to have your baby's first bath whenever you like, as long as they're medically stable, and we do have the option of doing the bath in your room if you would like to watch and take pictures. Latest recommendations are delaying baths for about 24 hours postpartum. That is supposed to help baby with temperature regulation, blood sugar stabilization, and breastfeeding. We have a lactation specialist here from 8 a.m. to 8 p.m. Monday through Friday, and we have lots of experienced nurses who are happy to help with breastfeeding if lactation is not available. We have a newborn channel that airs 24 hours a day. It explains everything from normal newborn care, bathing, shaken baby syndrome, safe sleep, and we encourage moms to watch that as much as possible just to learn as much information as they can before they go home. Before your baby is discharged, there are 3 screenings that we do. One will test for genetic diseases, one will test for congenital heart diseases, and the other is a hearing screen.
Whenever you walk into the NICU as a parent, there's a lot going through your head. It's a very stressful time, a very vulnerable time. It's a very strange environment. The rooms are full of beds that look like incubators, and there's a lot of different lines and poles. Our NICU is a level 3. It's a 24-bed unit that offers some private and some semi-private rooms. We have a whole interdisciplinary team that is a part of your baby's care. The neonatologist, the nurse practitioner, your nurse, the respiratory therapist. We also have a social worker in-house Monday through Friday on the floor. And then we have speech therapy, we have physical therapy. We also have an ophthalmologist that comes in. We offer a camera system called Angel Eye for the parents that are unable to be with their child during the day or even at night when you just want to take a look at your baby. It's a live stream that is able to show your baby's face, and just having that is so much comfort for a mom and dad, and you're able to give that password to families, friends, neighbors, whoever you choose. And it's really nice for families that have other children, because a lot of times the siblings, especially if they're smaller, have no idea what's going on. They know mom, had a baby in her belly and baby isn't home yet. So having that camera system, they're able to see their brother or sister and kind of be a part of that. Some resources that we offer here, we have donor breast milk. That's very essential for our really small micro preemie babies, for mothers who have trouble producing milk or can't produce milk at all. We do offer the cuddler program. We have someone who comes every single day, and having that connection of being held is very important for their development, and having that touch. The cuddlers will come in and they'll hold and give that baby that comfort that they need for development. We have other resources. We have the Ronald McDonald House especially for parents who live out of town or live further away and are unable to make that drive every day. It can be very, very hard sometimes. So we have that. And then we also partner up with Children's Miracle Network, and they're a very good resource for our parents and their families, and they provide a lot of resources that the parents can use. When you get close to discharge, we offer a service called rooming in or rooming out. It can be 1 to 2 nights that the parents can be in the room with the infant and taking care of the baby like they would if they were over in nursery without extra specialized care. It's basically that time they get that they missed out on originally. And during that time, they get up, they do all the feedings, they change all the diapers, but they always in the back of their mind have that nurse that is still on the floor that they can call and ask if I'm doing this right, if they have any questions, and so on. But they do, they take control of the situation, and they're the ones doing all of the care.
Thank you for taking the time to learn about our facility and what to expect as a patient. We look forward to giving you the best care possible.